when your horse is infected, basically the treatments that we have are tetracycline antibiotics, and you guys have probably had experience with this one way or another where we live in a tick endemic area. The two versions that we have are an IV tetracycline called oxytetracycline or an oral tetracycline called doxytetracycline. The protocol that we have come up with as a clinic that we prefer to use in Lyme disease infections as a short term of IV therapy, and it depends kind of on clinical signs, chronicity of infection, that sort of thing. And then going on to a long-term doxycycline therapy. This offers an advantage because IV tetracycline in the beginning will give us a higher tissue yield. We can't do it for the entire month or two that we want to do treatment. It becomes cost prohibitive. But if we can start out with a really high tissue concentration of the antibiotic, it can really help, one, get to the bacteria, and two, really help the anti-inflammatory effects that tetracyclines offer, as well as antimicrobial. So this is another really exciting area of changes that we've had in the Lyme spectrum. We don't have an approved horse vaccine. However, there's been some studies, again, out of Cornell, they've been kind of the forefront of all this, that have shown that the canine vaccine has some efficacy in horses. It's off-label use, so we are being a little bit careful about it, but there are quite a few clinics, especially on the East Coast, where this is very endemic as well, that have had great success, no reactions, good success with it. The few papers that have come out of Cornell have shown that antibody production occurs with these vaccines, so we would really like to give it a try. Unfortunately, the vaccine is not 100% effective, but it's one tool that we have that we hope will help prevent infection in horses. So with the vaccination and with this new test that we have available, we're able to separate the vaccinated horses from the infected horses, which is great, because that way if we vaccinate a horse, we can tell that that's what the increased numbers are from, rather than if it's infected. We can basically differentiate. We also have to remember that if the horse is infected, giving them the vaccine will not treat the infection. We still need to treat with the tetracycline antibiotics. So the reason that the vaccine would not treat an infection is the vaccine produces antibodies in the horse that we're hoping is going to go after the bacteria while it's still in the tick. So you know how I talked about how OSPA was produced by the bacteria while it was still in the tick? Well, this vaccine is trying to get the body to produce an antibody to OSPA. That way, when the tick attaches, does its blood meal initially, it brings in antibody which then attacks the bacteria while it's in the tick, before the bacteria even has a chance to get into the horse. It works well. It's not 100%, but it's a really good way to help prevent. Again, this is kind of what I was saying. We're trying to get to the Borrelia bacteria while it's still here, before it gets a chance to get here and invade the immune system like it's so good at doing. So why would we vaccinate if it's not 100% effective? Basically, it's one more tool that we have that we're trying to kind of help and give you options to try and prevent infection in horses. Lyme disease can be so debilitating. A couple different clients that I've been dealing with over this last year with this, and had good results with treatment, but in the beginning, it's really hard. They're lame, they're unhappy. It's very long-term treatment. So if we can give you an option to try and prevent this before we have to go through treatment, we would like to do. Also, studies have shown that natural infection with Lyme disease bacteria does not produce significant amounts of the OSPA antibody, so we're not going to see the same effect with the natural infection that we would with vaccination. So reinfection commonly occurs in horses, which we see all the time. So if you're interested, what exactly does that entail? So we try to come up with a couple different options. Basically, this is no way a core vaccine. We're not saying you definitely have to do this, but if you want to, we want it to provide the ability to choose. It's an off-label vaccine, so we'd have to have you sign a waiver beforehand. But besides that, we can provide it along with all the other spring vaccines. We would advocate testing beforehand. So sorry, I'm jumping ahead. So there's two options. There's option one and option two. The first option, we would say, let's test. Let's see if your horse is infected, and then go from there. We'll either vaccinate or we'll treat. The second option would be, you're not showing any clinical signs of infection. Let's go ahead and just vaccinate. If we have to, we can test later if we need to. So within these options, we have a couple different scenarios. Option one, with scenario A in this option one, is that we would get a positive test with the multiplex assay. So then we would treat, we would do IV treatment along with a long-term oral treatment. Following that treatment, we would give the vaccine, booster in a month, and then we continue to booster every 6 months. These vaccines need to be continually boosted twice a year. And then if you want to, we can definitely recheck the antibody levels with the assay in the future. Scenario B for option one would be that you have a negative test. You're great, no infection. We go ahead and we give the vaccine, we booster in a month, and then we continue to booster every 6 months. If you don't want to do the testing in the beginning, which is a perfectly legitimate option, we would go ahead and give the Lyme vaccine with the spring vaccines, wait a month to booster, and we could even split up the vaccines quite a bit and administer the rest of the spring vaccines at a second visit, continuing to booster every 6 months. You would not know if, infection status, but that would be fine. We can always test later if needed. So cost breakdown for this. Basically, the initial visit, if you were to test, the cost of the test is a little expensive. It's $94.60, but it provides so much information that we recommend that you do it if at all possible. And we're trying to provide discounts. So if you have multiple horses on the same farm call, we'll provide a discount for that test. We can do that. Positive, we treat, then we would vaccinate. Once the treatment was over, we'd start on a vaccine schedule. The vaccine itself, plus a call charge for the first vaccine a month, do the same thing. And then 3 to 4 months, we can recheck if preferred. Negative test, same thing. We would just come, call charge, vaccine cost. Again, a discount if you wanted to test, and then going through the vaccination schedule. And then option two, same sort of thing. We would just come visit, do a call charge, and the vaccine cost. So